Have you ever wondered how psychiatrists know what disorder a person has? How do we distinguish between depression and grief, ADHD and anxiety, bipolar and borderline? Well, welcome to the Diagnostic Playbook of Psychiatry, the DSM-5. Today, we're breaking it down, plain and simple. No med school needed, no Latin required, just a crash course in how mental health diagnoses are made. Let's open the book and unlock the mind. Section 1. What is the DSM-5? DSM stands for Diagnostic and Statistical Manual of Mental Disorders, and the 5 means it's the 5th edition. Created by the American Psychiatric Association, it's the official guidebook used across the US and many parts of the world to diagnose mental illnesses based on observable symptoms. It's like a dictionary, but instead of words, it defines the patterns of thoughts, behaviors, and emotions. If you're being diagnosed with depression, schizophrenia, PTSD, or ADHD, chances are your provider is consulting the DSM-5. Section 2. Why was it created? Before the DSM existed, mental illness was a Wild West. Different doctors used different terms, and sometimes none at all. There was no consistency, no shared language, no standard treatment plans. So in 1952, the first DSM was born, with just over 100 disorders. Today, the DSM-5 includes nearly 300. It's not perfect, it's evolved, it's debated, but it gives us a common ground. Section 3. How it's organized. The DSM-5 is structured into categories based on related symptoms. Here's a peek at some major sections. Neurodevelopmental disorders, like autism and ADHD, schizophrenia, spectrum and other psychotic disorders. Mood disorders, including depression and bipolar disorder, anxiety disorders, obsessive-compulsive and related disorders, trauma and stressor-related disorders, like PTSD, substance-related, and addictive disorders, personality disorders, neurocognitive disorders, like dementia and more. Each disorder comes with a diagnostic criteria list. You must meet a specific number of symptoms within a certain time frame, and those symptoms must impair your functioning. Section 4. What makes a disorder? The DSM doesn't just say, "Are you sad?" It asks, "How long? How often? Is it impairing your work, school, or relationships? Is it due to something else, like drugs or a medical condition?" A mental disorder is defined by the presence of symptoms that are clinically significant and functionally impairing, not just quirky behavior or a bad week. That distinction matters. Not every oddity is a diagnosis. Not every sadness is depression. Not every energetic child has ADHD. Section 5. Case example. Diagnosing major depressive disorder. Let's say someone walks in feeling hopeless, fatigued, and can't focus. To diagnose major depressive disorder, the DSM-5 requires at least 5 out of 9 specific symptoms, like depressed mood, loss of interest, sleep issues, appetite changes, feelings of worthlessness, poor concentration, suicidal thoughts. These symptoms must last for at least 2 weeks and must cause significant distress or dysfunction. If only 3 symptoms are present, it may be something else. That's the precision the DSM aims for. Section 6. Controversies and criticism. Now let's be real. The DSM-5 isn't flawless. Critics say it sometimes pathologizes normal human experience. It can be influenced by pharmaceutical agendas. Diagnoses can overlap and feel too rigid or too vague. Cultural context is sometimes missing. But here's the truth. The DSM-5 is a tool, not a truth tablet. It helps clinicians, but clinical judgment and the whole human story matter just as much. Section 7. What changed in DSM-5? The 5th edition brought key updates from DSM-4. Asperger's syndrome became part of autism spectrum disorder. Mixed features can now be added to mood disorders. Hoarding became its own diagnosis. Bereavement exclusion for depression was removed. New categories like disruptive mood, dysregulation disorder were added for children. It tried to reflect the complexity of human minds, but it's still evolving. Section 8. The future. DSM-5 TR and beyond. In 2022, we saw the DSM-5 TR, the text revision. It refined language, added prolonged grief disorder, and improved clarity. But what's next? Some experts dream of a future DSM that includes genetics, neuroimaging, and biomarkers to make diagnoses more objective. For now, though, psychiatry remains a field that blends science, art, and empathy. Final thoughts. Educational, encouraging tone. The DSM-5 isn't meant to label people. It's meant to help them. It gives structure to chaos, language to pain, and direction for healing. But the book is just the beginning. The real story is in the patient, their history, their voice, their life. So the next time someone says, "I have a diagnosis," remember, it's not just a label, it's a clue on the map toward understanding, support, and recovery.